opening debate. The Honourable Member for Scarborough Centre.
Thank you, Madam Speaker. Madam Speaker, I rise to speak on Bill C-31, an act respecting cost of living relief measures related to dental care and rental housing. This is legislation that helps to address some of the concerns many of my constituents have shared with me around the rising cost of living and the increasing difficulty they are facing making ends meet. All of us in this House and in this country are seized with the issue of inflation. Indeed, the world is seized with the issue of inflation because it is a global phenomenon. Forces like high oil prices ripple through the supply chain, and so do supply chain disruptions, leading to scarcity of goods and rising prices for them. The economy is still recovering from the pandemic. We are all feeling the pinch. Canada has done better than most G7 countries, doing better than our American neighbors and peers such as United Kingdom and Germany. We have seen prices come down at the pumps. But according to the latest Statistics Canada numbers and what we are seeing at the grocery store, food inflation remains a serious problem. And while inflation is, as I said, a global phenomenon and a temporary one that will ease in time, that doesn't make the burden on Canadians today any less real and any less serious. And while you and I and our colleagues in this place can afford to absorb the temporary higher prices, not all Canadians are that fortunate. They need our help. Madam Speaker, and just like we always have been since the first act of our government after the 2015 was to lower taxes for the middle class and those working hard to join it by asking the top 1% to pay just a little more. We will be there for those Canadians that need help the most. Canadians are looking to their elected representatives for help. I was pleased to see Bill C-30 receive speedy support and passage at second reading so it could go to committee for further study. This is an important part of our government's response to the affordability challenges Canadians are facing. If passed, Bill C-30 will double the goods and services tax credit for 6 months, delivering $2.5 billion in additional support to roughly 11 million lower-income Canadians. For a typical family, this could mean up to $612 plus $161 for each child under the age of 19. I hope the cooperative spirit continues and we see this legislation passed soon so Canadians can get this much-needed help coping with the higher prices. And I hope, Madam Speaker, that this same cooperative spirit can prevail in this place with Bill C-31, because it also delivers much-needed help for lower-income Canadians struggling with higher prices, and they don't want to see politicians stalling on the help they need with political gains. There are two main components in this legislation. The first relates to dental care. While we here in this place benefit from generous employer-provided dental plans that cover us and our dependents, many Canadians are not so lucky. They are forced to pay for needed dental services out of pocket, including for their children, and beyond the cost of regular cleaning for their children, dental emergencies can also become financial emergencies and force very hard choices. Making life more affordable for families across the country must include making oral health care accessible for all. Dental care is an important part of overall health, yet in Canada, 1/3 of the population cannot afford it. Creating a proper national dental system from coast to coast to coast, integrated as part of Canada's healthcare system, will take time, and cooperation and coordination with the provinces and the territories. But recognizing that we need to start helping Canadians with these costs now. This legislation proposes a new temporary Canada dental benefit. The benefit would provide dental care for uninsured Canadians with a family income of less than $90,000 annually, starting with children under 12 years old in 2022. The Canada Dental Benefit would allow all eligible parents to access direct payments totaling up to $1,300 per eligible child under the age of 12, up to $650 per year to support the costs of dental care services. Once the program is live, Canadians will be able to access the Canada Dental Benefit through their CRA accounts, and the CRA is prepared to deliver and make it as easy as possible for eligible Canadians to get the money they need for oral health care. Dental health is an important part of our overall health and should not need to be sacrificed for financial reasons. With this bill, we are taking an important first step and putting more money back in the pockets of Canadians that need it the most. The second major component of Bill C-31 relates to housing. Affordable housing and the high cost of safe and suitable housing is one of the biggest issues for the residents of my riding of Scarborough Centre. And this legislation addresses one of the major components of housing that is so often ignored by the official opposition: rental housing. While they have a lot to say about home ownership, they have little to say and little to offer for those that rent their homes. I have a lot of renters in my community of Scarborough, and many of them are trapped in inadequate and substandard rental housing that doesn't meet their needs. I say they are trapped because they can't afford to move to a bigger unit or a nicer unit that could better suit their needs, because the market rent is now well beyond their means. And if they were to leave their current unit, it would be rented out for many hundreds of dollars a month more. Even within the guidelines, rent increases in combination with other high prices families are facing are difficult to manage. As part of the National Housing Strategy,
I apologize to interrupt the Honourable Member. Can I ask the Honourable Members to please keep the sound low so that we can listen to the speech the Honourable Member is making? Thank you.
Thank you, Madam Speaker. As part of the National Housing Strategy, we are addressing the issue of affordability and a lack of rental housing construction and capacity. We have introduced the Rapid Housing Initiative, a $2.5 billion program to finance the construction of modular housing, as well as the acquisition of land and the conversion of existing buildings to affordable housing. The Rental Construction Financing Initiative gives developers low-cost loans during the riskiest phases of construction. This helps developers to better predict cost, and they are more incentivized to build the rental projects, all while meeting important criteria in terms of affordability, accessibility, and energy efficiency. These programs are working, Madam Speaker, but it will take time to have an impact and begin bringing prices under control. And Canadians need help now. That's why this legislation proposes to invest $1.2 billion to provide a direct federal Canada Housing Benefit top-up payment of $500 to 1.8 million renters who are struggling with the cost of housing. This is in addition to the $4 billion we are already investing to provide an average of $2,500 in direct financial assistance with the cost of rent to Canadians across the country through the existing Canada Housing Benefit. This new one-time benefit would be available to applicants with incomes below $35,000 for families and $20,000 for the individuals who pay at least 30% of their income on rent. If this legislation is passed, eligible renters will begin receiving payments before the end of this year. To be eligible, applicants must have filed their 2021 tax return and will need to attest that they are paying at least 30% of their adjusted net income on rent. Families must have a net income of $35,000 and individual have an income of less than $20,000. An estimated 1.8 million low-income renters, including students who are struggling with the cost of housing, would be eligible for this new support. Madam Speaker, this is help that my constituents very much need. It will put more money back into the pockets of lower-income Canadians who need it to help buy groceries and put gas in the car so they can get to work. I urge my colleagues not to delay in passing this important legislation. Let's deliver help to those that need it the most. And
Questions and comments?